And we're back, ladies and gentlemen. First, we're going to do inhalation cranial fault, and then next, we're going to do exhalation cranial assist cranial fault. So first, for inhalation, we're going to establish a good indicator muscle, which we're going to use the pec clavicular. So hold, strong, 5 out of 5. We'll do autogenic inhibition, recheck it. It should go weak, 4 out of 5, and then we know we have a good indicator muscle. So next, we're going to jump into a rebound challenge on the mastoid. So since this is inhalation, we're going to go P to A on each mastoid, and then check. Okay, this one's about 4 out of 5, so this is the weak side, so this would be the positive side, but we still want to check the opposite side. So we're going to go to mastoid on the left side, go P to A, release, and then check, and it's strong, 5 out of 5, so now we know the positive side is the right side. So next we're going to push P to A while they inhale. So they're going to inhale, we're going to push P to A 4 to 5 times. So inhale, and exhale, inhale, exhale, inhale, exhale, inhale, exhale. Okay, so now we're going to rebound challenge the mastoid again, and then we're going to check the muscle, and it goes strong, 5 out of 5. So next we're going to do exhalation assist cranial fault, which is going to be the opposite. We're going to still use the same indicator muscle, but we're going to rebound challenge A to P on each mastoid one at a time. So we're going to rebound challenge A to P. Hold, and this one goes weak, 4 out of 5, so we know the positive side is the right. We still want to check the left. Then we're going to go A to P, and check, hold. Okay, 5 out of 5, so we know the positive side is the right side. So next we're going to do we're going to apply A to P pressure on exhalation, not inhalation. So we have patient take a deep breath in, and then exhale, inhale, exhale, inhale, and inhale one more time. And you're going to do that 4 to 5 times. And then next, we're going to let the patient kind of sit here for a little second. Then we're going to retest the rebound challenge on the positive side, going A to P, and then we'll check the muscle. And it goes strong, 5 out of 5. Okay, next we're going to do the spinobasilar inspiration assist cranial fault. So for this rebound challenge, you have to push P to A on each mastoid, one at a time. And then also simultaneously you're going to do I to S on the palate, which we're not going to do that because we don't have any gloves, so I'm going to just show you by doing it outside of the mouth. So first, I'm going to establish a good indicator muscle. We're going to use pec clavicular throughout this whole video. But so we're going to use that one, so it's a good indicator muscle. So we're going to go to the right side. I'm going to go P to A on the mastoid, and then I'm going to go inside the patient's mouth, go onto the palate, and go I to S, and then simultaneously I'm going to rebound challenge. And then I'm going to come back and test the muscle, which it goes weak, 4 out of 5. So this is the positive side, but still want to check the opposite side too as well. So I'm going to go P to A on this mastoid, and then simultaneously go I to S on the left side of the palate. And then do a rebound challenge, and then come back and test the muscle, which goes 5 out of 5. So now we know the right side is the positive side. So on this side, what I'll have the patient do, I'm going to push P to A on the mastoid, I to S on the palate on the right side simultaneously. But on this one, I'm going to have the patient breathe in, and then when they inhale fully, I'm going to have them forcefully inhale just a little bit more, and once they do forced inhalation, I'm going to rebound, I'm going to push P to A, I to S on the mastoid and the palate. So I would do that 4 to 5 times. So I have the patient breathe in, okay, then forcefully, and then I would push simultaneously. Then I'll do that 4 to 5 times. Let the patient sit for a little bit. Then I'll do a rebound challenge, P to A on the mastoid, I to S on that palate, and then retest the muscle, and it goes strong, 5 out of 5.
1.
Okay, next we're going to do spinobasilar expiration assist cranial fault, which is going to be the opposite of inspiration, but we're going to do a different contact. Indicator muscle will be pec clavicular, so we're going to do a rebound challenge. We're going to do A to P on the mastoid on the right, so we're going to go A to P, and then simultaneously we're going to go P to A on the maxilla. So we can't do it inside the mouth, gloves, so we're going to do on the side of the mouth. So simultaneously do the rebound challenge, check the muscle. Goes weak, 4 out of 5, so we know this is the positive side. We're going to come back to the opposite side, the other side, and do the same thing. We're going to do A to P on the mastoid. So we're going to come down, and then simultaneously we'll go P to A on the maxilla. So we're going to go posterior anterior. Then we check 5 out of 5, strong. So next what we're going to do on the positive side, we're going to do the we're going to push A to P on the mastoid, and then pull A to P on the P to A on the maxilla 4 to 5 times during forced exhalation. So I'm going to have the patient breathe in, then breathe out, and then forcefully breathe out. And then when they forcefully breathe out, I'm going to go A to P on the mastoid and PA on the maxilla 4 to 5 times. So I'll do that 4 to 5 times. Once I'm done, let them sit for a little bit, and then I'll rebound challenge on the positive side. I would go A to P on the mastoid, and then P to A on the maxilla, rebound challenge, and then test the muscle. It goes strong, 5 out of 5. Okay, next we're going to do the glabella cranial fault. So for this one, we're going to rebound challenge. Well, first we have indicated muscle, pec clavicular, same one, good indicated muscle. Rebound challenge. They approximate the EOP on the back of the head and the glabella at the same time. So we're going to rebound challenge, and then we're going to test the muscle, and it goes weak, 4 out of 5. So now we need to figure out if it's which inhalation is it through the nose or through the mouth. So what we're going to do, we're going to rebound challenge with the patient breathing in through their nose. Breathe in, inhale, okay. You can exhale and hold. And that goes weak, 4 out of 5. So we know that it is the nose, but we still want to check inhalation through the mouth. So we're going to rebound challenge while the patient breathes into their mouth. Okay. And then we're going to test the muscle. Strong, 5 out of 5. So we know it's the nose. So first what we're going to do, we're going to do 4 to 5 times pressing on the glabella and the EOP simultaneously while the patient breathes in through their nose. Okay, so breathe in through your nose, and exhale. Breathe in through your nose, exhale, and I'm going to do that 4 times. And then next, what I'm going to do, I'm going to come to the patient's, I'm going to put my pinky finger on the EOP, my ring finger on C1, my middle finger on C2, and then my index finger on C3. So what I'm going to do, I'm going to, as the patient breathes in through their nose, I'm going to simultaneously push on the glabella and kind of bring their chin up. Okay, breathe in. Okay, I would do that 4 to 5 times. And then next, I would do a rebound challenge on the EOP and glabella, and then retest the muscle, and it should go strong, which it does, 5 out of 5. Okay, next we're going to do the temporal bulge cranial fault. For this one, we're going to use the same indicator muscle, pec clavicular, and we're going to do a rebound challenge on the ipsi frontal bone and ipsi occipital bone. This is going to be done on both sides, but for the video, we're going to do it on one side. Basically, you want to go from ipsi frontal to ipsi occipital and approximate the two, and then you're going to muscle check, muscle test, and that one's pretty weak. So this one right here, we're going to try to find which one's the weakest. So next, we're going to approximate the frontal bone and occipital and go with a clockwise torque, and then we're going to check. Weak, but not as weak as the first one, and then we're going to go counterclockwise with it. We're going to muscle test, and that was pretty strong. So through the 3, the straightaway one was the weakest. So that's the one. That's the direction we're going to work with. So what we're going to do, we're going to do this 4 to 5 times. We're going to have the patient take a half inhalation in, and then I'm going to pull down and exhale. And then inhale, pull down, exhale, and we'll do that 4 to 5 times, and then we'll do one more rebound challenge with the straightaway. Straightaway on the frontal bone and occipital bone, and then recheck the muscle, and it goes strong, 5 out of 5. Next, we're going to do parietal descent. So first, we're going to do a rebound challenge by flicking I to S on each parietal bone. So we're going to flick I to S. Can't see it, but I'm going I to S on the parietal bone. And then I'm going to recheck with the indicator muscle, and it's strong, 5 out of 5. And then I'm going to do the left side by flicking I to S on the parietal bone, and this one goes weak, so it's 4 out of 5, so this is the side we're going to use. We're going to cross our thumbs over the sagittal suture on the top of the head, and then we're going to apply pressure with my fingertip on the parietal bone. You know you're on the parietal bone because you're 2 inches above the pinna of the ear. So what we're going to do, we're going to lift the involved side up on a half-held exhalation, 4 to 5 times for about 4 to 5 seconds. So the patient's going to breathe in, and then exhale, stop, and we're going to lift. We're going to hold that for 4 to 5 seconds, breathe out, breathe in, breathe out, hold, 4 to 5 seconds, and we're going to do that 4 to 5 times. And then we're going to rebound challenge on the left side by flicking I to S, and then we're going to retest check the muscle, and it goes strong, 5 out of 5.